Question. A 65-year-old patient is admitted with a diagnosis of dehydration. The nurse reviews the basic metabolic panel, BMP, and notes a serum sodium level of 148. Which action should the nurse prioritize? A. Encourage increased oral fluid intake. B. Administer normal saline. C. Restrict dietary sodium. D. Administer furosemide. E. Monitor for signs of hyponatremia. The correct answer is B. Rationale: administer normal saline. A serum sodium level of 148 indicates hypernatremia, suggesting dehydration. Administering normal saline is a priority to correct a dehydration and normalize sodium levels. Options A and C are focused on sodium intake, but the immediate concern is correcting the existing imbalance. Option D, if furosemide, is contraindicated as it may worsen hypernatremia. Option E, monitor for signs of hyponatremia, is incorrect as the patient is experiencing hypernatremia. Question. A patient with chronic kidney disease undergoes routine laboratory testing, revealing a serum potassium level of 6.2 mg/L. What intervention should the nurse implement first? A. Administer oral potassium supplements. B. Encourage a diet rich in potassium. C. Administer IV calcium gluconate. D. Initiate continuous cardiac monitoring. E. Administer IV regular insulin and glucose. The correct answer is D. Rationale: initiate continuous cardiac monitoring. A serum potassium level of 6.2 mg/L indicates hyperkalemia, which poses a risk of cardiac arrhythmias. Continuous cardiac monitoring is essential to detect and manage potential cardiac complications. Options A and B could exacerbate hyperkalemia and are contraindicated. Option C, IV calcium gluconate, is used in emergencies but is not the initial priority. Option E, IV regular insulin and glucose, is used to shift potassium into cells but should be implemented after cardiac monitoring is initiated. Question. A 40-year-old diabetic patient presents to the emergency department with confusion and lethargy. The BMP reveals a blood glucose level of 600 mg/dl and a serum osmolality of 320 mosm/kg. What is the nurse's priority action? A. Administer IV insulin. B. Administer IV 0.9% normal saline. C. Assess for ketones in urine. D. Encourage oral intake of glucose. E. Administer oral hypoglycemic agents. The correct answer is B. Rationale: administer IV 0.9% normal saline. The patient's elevated serum osmolality and hyperglycemia suggest hyperosmolar hyperglycemic state, HHS, which is associated with severe dehydration. Administering IV normal saline is crucial to correct dehydration. Option A, IV insulin, is appropriate but should follow fluid resuscitation. Option C, assess for ketones, is relevant but not the immediate priority. Options D and E are contraindicated as the patient requires fluid replacement before addressing hyperglycemia. Question. A 55-year-old female patient with a history of hypertension is admitted with complaints of fatigue and muscle weakness. The basic metabolic panel, BMP, reveals a serum potassium level of 2.6 mg/L. What nursing intervention should be prioritized? A. Administer IV calcium gluconate. B. Initiate continuous cardiac monitoring. C. Encourage a diet high in potassium. D. Administer oral potassium supplements. E. Administer IV normal saline. The correct answer is B. Rationale: initiate continuous cardiac monitoring. A serum potassium level of 2.6 mg/L indicates hypokalemia, which can lead to life-threatening cardiac arrhythmias. Continuous cardiac monitoring is crucial to detect and manage any cardiac complications promptly. Options A, C, and D are inappropriate as they may exacerbate hypokalemia or cause imbalances. Option E is not the immediate priority. Cardiac monitoring takes precedence to ensure the patient's safety. Question. A 70-year-old male patient with chronic renal failure undergoes routine laboratory testing, revealing a serum phosphorus level of 6.2 mg/dl. What dietary recommendation should the nurse provide to assist with managing this finding? A. Increase intake of dairy products. B. Limit intake of red meat. C. Increase intake of whole grains. D. Limit intake of fruits and vegetables. E. Increase intake of fatty fish. The correct answer is A. Rationale: increase intake of dairy products. Elevated serum phosphorus levels in a patient with renal failure indicate hyperphosphatemia. Dairy products are high in phosphorus, and increasing their intake can contribute to the binding of phosphorus in the gastrointestinal tract, reducing absorption. Options B, D, and E are not specific to phosphorus levels, and option C may exacerbate the issue by providing additional phosphorus. Question: a 45-year-old patient is admitted with severe vomiting and dehydration. The BMP reveals a serum bicarbonate level of 18 mg/L. What nursing intervention may be done to address this imbalance? A. Administer IV normal saline. B. Administer IV sodium bicarbonate. C. Encourage deep breathing exercises. D. Monitor for signs of metabolic acidosis. D. Administer oral potassium supplements. The correct answer is B. Rationale: administer IV sodium bicarbonate. A serum bicarbonate level of 18 mg/L indicates metabolic acidosis, and administering IV sodium bicarbonate helps correct this acid-base imbalance. Options A and D address dehydration and acidosis but do not directly correct the bicarbonate level. Option C is not relevant to the specific imbalance. Option E is unrelated to the acid-base status presented in the scenario. Question: a 30-year-old patient with a history of diabetes presents to the clinic with complaints of increased thirst and frequent urination. The basic metabolic panel, BMP, reveals a blood glucose level of 250 mg/dl. What action should the nurse take first? A. Administer IV regular insulin. B. Encourage increased oral fluid intake. C. Administer IV 0.9% normal saline. D. Initiate continuous cardiac monitoring. E. Administer oral hypoglycemic agents. The correct answer is C. Rationale: administer IV 0.9% normal saline. The elevated blood glucose level and symptoms suggest hyperglycemia and dehydration. Administering IV normal saline is essential to address dehydration before initiating insulin therapy. Options A and E are relevant but should follow fluid resuscitation. Option B addresses fluid intake but does not prioritize the immediate concern. Option D is not necessary at this point in the care. Question: a 50-year-old patient is admitted with suspected hyperparathyroidism. The BMP reveals a serum calcium level of 12 mg/dl. What nursing intervention is essential for the management of hypercalcemia? A. Encourage increased oral calcium intake. B. Administer IV furosemide. C. Administer IV calcium gluconate. D. Initiate continuous cardiac monitoring. E. Encourage a diet low in vitamin D. The correct answer is B. Rationale: administer IV furosemide. Hypercalcemia is associated with dehydration, and administering IV furosemide helps promote calcium excretion. Options A and C are contraindicated as they would increase calcium levels. Option D is important for other electrolyte imbalances but is not the immediate priority. Option E is not directly related to hypercalcemia management. Question: a 25-year-old female patient is admitted with suspected anorexia nervosa. The BMP reveals a serum potassium level of 2.8 mg/L. What nursing intervention is crucial for managing hypokalemia? A. Administer IV potassium chloride. B. Initiate continuous cardiac monitoring. C. Encourage a diet high in potassium. D. Administer oral potassium supplements. E. Administer IV calcium gluconate. Rationale: the correct answer is B. Initiate continuous cardiac monitoring. Hypokalemia can lead to cardiac arrhythmias, and continuous monitoring is essential for early detection and management. Options A, C, and D are appropriate interventions to correct hypokalemia but should follow cardiac monitoring. Option E is unrelated to potassium balance and is not the immediate priority. Question: a 45-year-old patient with a history of chronic kidney disease presents to the emergency department with nausea, weakness, and confusion. The basic metabolic panel, BMP, reveals a serum potassium level of 7.2 mg/L. What is the nurse's priority action? A. Administer IV. Normal saline. B. Initiate continuous cardiac monitoring. C. Administer oral potassium supplements. D. Encourage a diet high in potassium. E. Administer IV. Calcium gluconate. The correct answer is B. Rationale: initiate continuous cardiac monitoring. A serum potassium level of 7.2 mg/L indicates severe hyperkalemia, which can lead to life-threatening cardiac arrhythmias. Continuous cardiac monitoring is crucial for early detection and intervention. Option A, IV. Normal saline can help temporarily shift potassium into cells, but continuous monitoring is necessary. Options C and D would exacerbate hyperkalemia. And option E, IV. Calcium gluconate is used in emergencies but is not the initial priority.